Every day that we're without a drug to address COVID-19, thousands of people die. While drug companies and researchers worldwide struggle to find treatments, we and our loved ones are at continuous risk. Hi, I'm Scott Edgar, CTO of Aris MD. A typical drug brought to market goes through 4 phases of clinical trials, with the majority of those drugs, 72%, not passing the first 2 phases. It takes on average 10 years for a drug to go from initial trials to market, and the estimated cost of the process averages from $2 to $3 billion. This process is long and expensive and typically relies on patient feedback and testing of blood and other secondary methods for results, which can lead to inaccurate or indeterminate results. So what do we do in a pandemic? Time is critical when dealing with an outbreak, and we can't wait 10 years for a solution. We believe that our software has the ability to use DICOM imaging, which is diagnostic imaging from machines like MRI, CT, ultrasound, X-ray, to accelerate drug trials and provide concrete empirical evidence for trials. With high-resolution imaging, we would be able to detect microscopic changes, whether improvements or degradations, of a patient's body. With diagnostic imaging, a typical scan is done by taking a slice every 1 to 4 millimeters. This discards a vast majority of the scan data in order to keep the quantity of data small enough for a human doctor to look through in a reasonable amount of time. Our artificial intelligence system keeps and examines the entire data set in real time, which would give accurate and near-instant results to doctors and researchers. By providing rapid and accurate results, we believe the trial process can be expedited and either moved on more quickly or closed earlier. For a case like COVID-19, we could look at the lungs of a patient, for example, before, during, and after administration of a drug or treatment, which would give rapid and conclusive evidence as to whether or not the drug or treatment is effective. By doing this early on in a trial, and by doing this frequently, we can expedite the process of the trial and hopefully bring these drugs to market sooner. Drug trials are lengthy and costly. Every moment we spend waiting for treatments costs lives and puts society at risk, especially in a pandemic like COVID-19. Early identification of impact and adverse effects could revolutionize the way clinical trials are done, speeding up the FDA approval process and making treatment more affordable for all. We believe we can help expedite trials of life-saving treatments. We're ready to help. Thank you.